is 9 o'clock, so we're going to get started and open us up in a prayer. Chairman Hickman.
Yes, sir. Thank you, sir. Let us pray. Lord God, you've given us another great day, Heavenly Father. Please help us to honor you in all the things we say and do. Lord, please continue giving us the will and the wisdom to work for the great people of Georgia. In your Son's name we pray. Amen.
Hit the wrong button there. All right. Just ground rules. I know that we've tried to communicate to everybody, but we have a lot of people to speak and a limited amount of time. And if we have time at the very end for a couple of additions, we will. And what I'd like to do is, I think we said maybe 2, 3, 4, 5 minutes, but I don't really want more than 30 seconds to introduce who you are. If you do more than 30 seconds, I'm going to cut you off. So sounds like my mic got cut off there too. I am not looking for long speeches and discussions, but I am looking for a true, honest discussion about the changes in the budget. If you don't have the changes and you don't have the lines, because I don't want the House lines, I want our lines, because that's what we're going on. There's a budget sheet right there for you. You can come up there and grab it ahead of time if you want to. And if you're not ready, we can move on and come back to you. So everybody is important. So no one as important as DBHDD. So also to include the Georgia Council on Developmental Disabilities. Your time clock is going. All right, Chairman, and let me make sure I had done this one with this mic. There we go. You got it.
Thank you, Mr. Chairman. I will just quickly thank the Senate and the House for the $20.7 million for the Jail Restoration Center in Augusta and the $409 million for the new hospital. Sheriffs in Georgia have been a lot.
So that's in the bond package.
That was in the amended budget.
Amended budget.
Yes.
All right, move on. That's history, baby. Come on, let's go.
Well, it's always good to thank you. So we've got slide 2 here. These are statewide adjustments. I'm not going to spend any time on those, Mr. Chairman. If anybody has any questions, I'll obviously be able to answer those, but you'll see that in every budget. Starting in adjustments for addictive disease, starting at line 61.3, replacing some state funds with hepatitis C screening. You saw that in the amended budget. Also, eliminating some one-time funds for Hope House, 61.4. Then the opioid trust, 61.5. This is the House has put some dollars from the opioid trust to replace state funds. That's the opioid trust dollars that you all appropriate within the House and Senate. Any questions on that, I'll be glad to answer them. Then the next slide, adjustments for IDD services. This is obviously we have 7,900 individuals on the now comp waiver. We're on track to enroll about 1,000 new individuals to the now comp waiver this year. Line 63.6 is $3.2 million annualized funds for 150 now comp waivers you provided last year. 63.7 is 200 additional waivers. The governor had recommended 100. The House added an additional 100. The next item, 63.8, is $2.8 million reduction to reflect federal Medicaid assistant percentage. Again, you're very familiar with that. 63.9, $513,000. That's an increase to the now comp program administration. 63.10 is $100,000 increase for citizen advocacy to expand services. That was a House ad. And then also just a note, GVRA budget, they placed $400,000 to increase funding for family supports. That's on line 208.5. I'm sure that when you hear from Executive Director Wells, he will not exactly know what that is. I think that's just needs to be moved over to our budget. So that's something we can talk with your folks about. Next is our adult forensic services, $1.6 million to annualize the New Hope project at West Central, which we just opened, and it's already has patients. 64.5, $250,000 restore Cobb. You also saw that in the amended budget. Next is the adult mental health services, line 65.5, $2.3 million to increase funds for mobile crisis. This is a statewide bid that was done by DOAS, and this was the increased cost for that. It hadn't been bid in quite a few years. $2.9 million, line 65.6. This is some increased funding for 988. This is due to a federal grant going away. This is to keep services status quo there, to keep the same number of folks answering calls. We received over 350,000 text chats and calls last year, 1,000 on average per day coming into that center. 65.7 is $9.3 million. That's the 404 housing choice voucher or housing vouchers that you've heard about for the DOJ settlement. That was the item that the DOJ agreed to let us out of the settlement agreement, and that was part of that agreement. 65.8, 326,000 reduction to reflect again the FMAP 66.4 to 66.3. Line 69.3, $1.1 million to annualize the operational cost at Gateway, which is a new child and adolescent center there in your area, Senator Watson, that's going to open later this fall. 69.4, this is $600,000 increased funds for psychiatric faculty discharge planning. It's my understanding that that was added by the House for some specialists to work within the PRTFs to help folks come out of those centers. And then Department of Administration, this is some ads that went, again, you'll see these statewide added by the House. It's 70.6, that's $14,471 to increase the hourly rates for special assistant attorney generals and paralegals. That's not just specific to DBHDD, that's across the board. It's not something that we specifically requested. 70.7, that's $200,000 increase cost to create the Georgia Mental Health Consortium to expand workforce capacity. This has to do with working to try to create some statewide telehealth options. Mr. Chairman, that's all of the changes to the budget. Again, I'm trying to be as quick as I can, but I'm happy to answer any questions.
That was great. Maybe I'll do it in reverse then. 70.6, y'all didn't ask for that, and I don't think anybody did, but I saw their pay scale for that. That's the Special Assistant Attorney Generals, and why is their pay less than other departments?
I can't speak to that. We got a reach out from I think some conversations between House Budget and OPB about that, and obviously we support that increase, but we're not.
I know you didn't ask for it. Okay, so no. All right. 69.3, just you pointed out that it is being built down in my area, Gateway, Savannah, but it covers just Chatham County?
No, sir, it'll cover the entire state, but definitely that entire region of the state.
Right. Just wanted to clarify that. And DOAS, 65.5. Tell me about that a little bit.
Okay, that is mobile crisis. So we do about 4,500 mobile crisis dispatches a month here in Georgia. That's a two-person team. DOAS rebid that contract. It had not been bid in quite a few years, and obviously with inflation, that contract increased, and that's the total amount to cover that increase. Okay. That's not us adding any additional services. That's to keep it status quo.
All right, I think that's important for us to note. The 69.4. Can you give me some more details where'd that come from? Because it was not in the governor, it was in the House.
It was in the governor's budget. The governor did recommend replacing those dollars. This has to do with a cut that we got last year for jail-based restoration in Cobb. We have 20 beds there. They've served over 30 different counties in Georgia. It's not just for Cobb. We take inmates from all over the state. This is something that our hope would be as the new hospital comes online in the future, we would be able to not have this in the future, but for now it's helping us restore inmates.
Yeah, I don't have it in the governor's budget.
Okay, I may be incorrect, then it may have been added to the House.
So any details on that? So is that the future, the 400 bed?
No, this is $64.5, $250,000. That was last year. The Senate cut $500,000 out of that line item. We were able to keep that open in Cobb. It's served over 82 people. This is again for folks.
69.4.
Oh, I'm in the wrong line item. I'm sorry.
All righty.
Yes, this was a House ad, $600,000. This again, I think Senator Kirkpatrick may have some information on this. This is something that the House added, was not in the governor's budget. It's my understanding this is to put a planning specialist at the PRTFs.
And do we have that at present? How many? Is this an increase? Where are we with that?
Yes, sir. This is not something that we were specifically engaged with adding to the budget, but PRTFs typically are operated under DHS contracts. We also obviously assist getting some children into PRTFs. We also get called upon to try to help get kids out of PRTFs. And I think this idea here is to have some specialists start working with the families and the children while they're in the PRTF to try to find community-based placement, because a lot of individuals are getting stuck at the PRTF. And I know that senators and representatives and others have heard some complaints on that.
70.7. How's that funding? Tell me some details on that.
So this is a House ad. Currently, there is a child and adolescent consortium where pediatricians can call a line to talk to a child psychiatrist if they're a primary care physician and they're trying to treat someone in their community and they need some assistance from an expert. The idea here is to expand that to include working with Dr. Sumner, working with AU, working with the other University Hospital at the University of Georgia to look at doing fourth-year residents to be able to run a call line, fourth-year psychiatry residents. So if you're a primary care doctor anywhere in the state, especially rural Georgia, and you're trying to serve someone that might need psychiatric medication, for instance, and you don't feel qualified, you can reach out and they'll be able to assist you at no cost, and it'll be answered real time.
Okay. All right. Any
Just one more comment about the discharge, PRTF discharge planning. That's really important because those people have got to go somewhere, and if they don't meet criteria for being in the hospital anymore, you can't just discharge them with no place to go. So that's really important to improve coordination and care.
Yeah.
All righty. That could be a record. Commissioner Tanner, you did great. Thank you so much.
Thank you.
All righty. But quick and efficient. Thank you. All right. It's just a small portion of the budget. DCH. Okay.
Sorry, you could call Georgia.
I take that back. I skipped the Georgia Council on Developmental Disabilities. I'm sorry about that.
I will do my best to be absolutely quick.
Well, you know, he did it in about 10 minutes, so.
Well, I will definitely not be
Okay.
10 minutes.
All righty.
My name is Rena Harris, and I'm the Chief Program Officer with the Georgia Council on Developmental Disabilities. We are an independent state agency. We are governed by a council of members. Over 60% of our members are people with developmental disabilities or their family members. We are roughly 70% federally funded, and today we'll discuss our state funding. The only change to our state budget is the standard reduction in employer contribution to the state health benefit plan. Looking at our state funds, almost all, per legislative intent, are for inclusive post-secondary education. There are 10 inclusive post-secondary education programs across Georgia. Enrollment for this school year is 158 students. This year, 121 of the 158 students are using the IPSI Grant State Scholarship to pursue their higher education. IPSI students are not eligible for the Hope Scholarship. In 2023, legislation was created to offer IPSI grant scholarships with a sunset date. We hope that you are going to see legislation very soon to make the IPSI grants permanent, and we hope that you will vote in favor of that. As you know, we underwent a programmatic audit last year, or IPSI did, rather, which sparked conversation about the future of IPSI.
So we use a lot of acronyms up here,
I
and
apologize.
we're being streamed, and maybe 3/4 people here know what they are, but
I apologize.
those online may not. Thank you.
IPSI is Inclusive Post-Secondary Education. That's where students with intellectual disabilities pursue the chance to attend college with their peers who may or may not have a disability. 10 programs across Georgia, 158 students. So the Inclusive Post-Secondary Education Program underwent a programmatic audit last year. This sparked conversations about the future of inclusive post-secondary education. We will be transitioning the council's role in inclusive post-secondary education to another entity effective July of 2027. We're currently in conversation with the Ralston Center at the University of Georgia, as well as Georgia Vocational Rehabilitation Program, or GVRA. And we will keep you updated on this, and we look forward to making that transition a success. Would like to move on to talk about our favorite topic now, and comp waivers. As you know, waivers allow people with developmental disabilities to live in the community instead of institutions. On page 4 of your tracking sheet, you'll see the governor's budget added 100 new waivers, and the House increased it to 200, and we appreciate that very much. There's also an increase of $513,558 for the Department of Behavioral Health and Developmental Disabilities to administer those waivers. Unfortunately, it is not enough to meet the urgent need in Georgia. We received data from the Department of Behavioral Health and Developmental Disabilities after the governor drafted his budget. We support best practice and common sense. In reality, everybody on the list needs a waiver once they turn 22 and age out of school. There are thousands of families that find themselves in dire straits trying to figure out what to do with their family member who has graduated high school and wants to move on to the next step, but unfortunately does not have a waiver available. Over age 22, this is currently over 4,600 people, according to data from the Department of Behavioral Health and Developmental Disabilities, which I will refer to as DBHDD. Per DBHDD data, 1,678 Georgians direly need a waiver now. You'll see that the chart breaks down the categories to total up to 1,678 people. I won't go through all of them now, but you'll see there's 60 and older, people coming out of state hospitals, people aging out of school this year. The work group that we participated in with DBHDD, we considered attrition because some people die or get moved to nursing homes or leave the state. So we concluded that 1,217 new waivers are needed in state fiscal year 27 just to cover the most urgent. Again, the House version of the budget gets to 200 new waivers, so we're asking you for just over 1,000 more just for the Georgians in urgent need of a waiver. Our other immediate recommendation, co-developed with the work group, is that DBHDD will need 26 new staff positions to administer the urgently needed waivers. The House added $513,558. We're asking for an additional $2,033,554 to meet the need. So why are we in this position? The chart shows that Georgia has invested roughly 54% of the national average in its citizens with intellectual and developmental disabilities. So, yes. Georgia's intellectual and developmental disability fiscal effort, Georgia's investment is 54% of the national average. And if you look on the chart, we are just above Alabama, but we are below Kentucky and Tennessee and South Carolina and Florida.
I appreciate that. Can you share that data with us and follow up with us? That would be great.
Absolutely.
Thank you so much.
Will you give them the-
We're going to move on to DCH, Department of Community Health. And
Thank you very much.
You're welcome. Thank you. All right, Commissioner, thank y'all for being here. Floor is yours.
Thanks, Mr. Chairman, members of the committee, and honor of the theme of brevity, I'm going to turn this over to Cody Whitlock, and he'll go with the House changes.
All right, Cody, thank you.
Good morning, Chairman, members of the committee. Similar to DBHDD, I will just be highlighting the House changes from the governor's recommendation. Happy to dig into any details that y'all may have. Looking at our first slide, I just want to go ahead and highlight statewide changes. That's going to be across the state agency, state enterprise, standard billing adjustments that everyone will see in their budget. Moving into programmatic changes, the first change from the House is 84.10. This is conversation related to, I believe, House Bill 139. There was some additional conversation around the 340B program, and so the House is just asking us to do a report related to 340B.
Is there a significant budget issue with that? I mean,
No, sir, there's not.
Great.
It's just a yes item, and we'll do the report.
so let the record show that you're not asking for any money to do this, and
sir.
and we are so proud of y'all. Thank you for that. So thank you. So
But if you have
340B.
extra, Mr. Chairman, then
Yeah, absolutely.
The next item, 84.11, this was part of an agency ask of positions when we submitted the governor's recommendation. These are 17 positions. This is mainly around compliance associated with that, managed care, home and community-based services, HCBS, autism services, UAT, user awareness testing, et cetera. Happy to give you all the details if y'all don't already have those.
So this was an agency ad, and I'm sorry, not agency ad. This was not a governor's ad. This was a House ad.
Yes, sir.
Okay. And that's 8411.
Yes, sir.
Gotcha. Any more details on that, or?
Yes, sir. So it's 17 positions. It's 6 MCO specialists, 4 HCBS specialists, 1 emergency transport specialist, 1 autism specialist, 1 children's health specialist, or 2 children's health specialists, 1 UAT, and then 2 pharmacy specialists. So really focusing on the compliance side of things, trying to tighten up those teams all within our Medicaid MAP division, and focusing on those areas that I referenced earlier.
it's
Okay.
kind of a waste and abuse targeted
Okay.
increase in personnel in that area.
All right. That's great. Okay. So thank you.
Yes, sir. And just for the record, all those positions 50-50 funded. So this is the state portion. The federal would be that other match at 50-50. So
So it's 50-50, not 60-40 or whatever.
correct. Administrative is typically 50-50.
Great. Gotcha. Thank you.
The next item in my table, dentistry and pharmacy, I understand that Clint will be presenting later today, so I'm going to go ahead and let him present on his items, but just highlighting those because they are programmatic within our budget. Moving to healthcare access and improvement, the first item was actually a no from the governor's recommendation, 87.3. The governor recommended elimination of one-time funding for telecare and maternal health programs, and the House recommended no to keep that $250,000 in the base funding. Moving down to 87.6, this is psychiatric or mental health stabilization services for a level 1 trauma center that has some qualifiers. I don't want to necessarily read the whole item. It's my understanding that is Memorial in Savannah. Moving down to 87.7, this is colorectal cancer screenings. This would be going to all the FQHCs. There was some money in the amended 26 budget for one FQHC to receive this funding, so my understanding is just the expansion of that program and putting it in the base budget. 87.8, one-time funding for PACE providers for transportation. We're actively engaging in the PACE regions and setting those regions and suppliers out there, and this would be a grant opportunity related to their transportation.
How many PACE awards have there been?
There's been one currently. We have two, because we have the notice of intent to award. So we have the Savannah region, and then we also have the Gainesville region that was just announced.
Is the next one Athens or Macon? Is that?
Yes, sir.
Okay. And that's the pilot projects that are for the state of Georgia, the pilots.
Well, these will be actual PACE centers. They won't be pilots. They will be full-fledged
Gotcha.
PACE centers.
Okay. And I'm going to back up a little bit to
Yes, sir.
87.7. I mean, I've seen the data on that, and that's for the federally qualified health centers and colorectal cancer
Yes,
screenings. They're picking up on people that would not have been screened and literally saving lives from that standpoint. But, all right, I just wanted to point that out.
Yes, sir.
Didn't mean to interrupt me. Head on.
87.9, this is the standard. The governor's office usually leaves money in the base. The General Assembly comes in, cleans it up, provides startup dollars for FQHCs if they see fit. So this is just that reduction that happens every year.
So I don't think we have anybody speaking from them. From my recollection, there are 140 counties are covered, and there are about 330 FQHCs, federally qualified health centers, which accept people for Medicaid or no pay and pay on sliding scale. So 330 clinics throughout the state. 140 counties covered. So that's pretty remarkable. And I don't know what the numbers were 10 years ago, but probably I suspect, a third of that, half of that. So that's impressive. Thank you.
Yes, sir. 87.10, one-time grants for emergency preparedness. My understanding is this is related to generators for facilities. I think there was some legislation maybe last year associated with potential emergency generators as well. 87.11 is adding REH's rural emergency hospitals to the rural stabilization grant application. They would be eligible, and also increasing that amount. For reference, we have about $2 million in the base for stabilization specifically, but that grant is a dual track program, so it's about $4 million total for the grant, but about $2 million for stabilization as a whole. 87.12. $2 million to address solvency. This is what we would be looking at, is to provide kind of one-time funds for hospitals, set up a structure in place for them to meet payroll, address underlying issues to generate revenues for their hospitals, not so much as the bank of Medicaid, so to speak. We don't want to have folks continuously coming back and addressing it, but this would be trying to establish a grant to really help the underlying issues of our rural hospitals that may or may not be struggling, and help them long term.
Guardrails on that?
That we don't have any yet, but that's how we would look to establish the program if it stayed in the budget.
Okay.
Could I ask a question, Mr. Chairman?
7, 5. Okay.
Thank you. This is 87.9. The House increased funds for the FQHCs on the colorectal cancer screenings, and then what's the eliminate funds? I think you referenced it, but
So the color, let me see if I can answer
sorry.
that.
Microphone.
87.7 is the colorectal cancer screenings that are being done
That's
in
right.
federally qualified health centers.
That's right.
The 87.9 is for a particular health center. Is that accurate?
Yes, sir. Annually, the General Assembly will fund 2, 3, 4 FQHCs with startup dollars.
In other words, adding on new.
Correct, and that's just since those were already stood up in FY26, you're just reducing those startup dollars.
What about 26 years? What?
In FY26, there was the 500,000 for those startups. So the House is just removing that because the FQHCs are now stood up and have the funds.
Thank you.
Yes, ma'am.
All right, keep on. Thank you.
Moving into healthcare facility regulation 88.4. This was an agency request for $1.4 million. It's a contract with the University of Georgia Public Health Disaster Management Program. This is a nurse aid and medication aid training and certification program. Historically, we've funded this through lapse within our healthcare facility regulation. We haven't been able to hire enough surveyors, so we've had some lapse that we've been able to use for that program. So given we've been able to hire some more folks, we're not seeing as much of a lapse, so we're looking to backfill and continue that contract.
So let me help understand, though. I understand when originally started this, UGA was the only one who could virtually do this, but throughout the state now, I understand there are lots of places that can do it virtually. Is that accurate?
I'd have to see, and I'm happy to provide that more
Okay.
information on that. Yes, sir.
If you can give us some follow-up, that'd be great.
Yes, sir.
Okay. Got a question from the chairman of Appropriations for Education. He has a much bigger budget than we do, but he has questions about health. Here we go.
Thank you, Mr. Chairman. I just got a question. If you would define for me a rural hospital versus a rural emergency hospital.
Rural emergency hospitals is a specific designation, so essentially there's no inpatient, and they're not paid in the same manner. They get, I think it's a monthly payment is how I understand it. Dr. Burke probably knows a lot more about it than I do.
It's a federal designation. It's not a state designation, but it is a category of hospital where they don't provide inpatient care, just emergency room services and referral.
Is that based upon the county size or something like that?
Well, there is a county size designation from the feds. Usually that's 50,000 and under. We've had, I think, 3 or 4 hospitals choose to go to that route, and I think just about all of them have backed out because, again, the financial model is not as lucrative as they thought it might be.
So they just have, this hospital just has an emergency room. They don't have inpatient care?
Right.
Oh,
That's
okay. I didn't realize that. Thanks, sir.
And they weren't eligible for that stabilization grants because
Thank
they
you.
were based on inpatient. The grant itself was. And
So
this
sort of
was
like a
request.
freestanding ER kind of thing.
It's kind of like that, but a little different. I mean, that's again, there's some nuances on the federal side, not ours.
On the payment stream.
Yes.
Yeah. But on the actuality of what they
What
do
they
is
do, that's right.
taking care of patients in an emergency situation
That's
and
right.
triaging them and getting them to wherever they need to be.
They have to discharge patients or transfer them within 24 hours, kind of that sort of thing.
Great, sounds good. Did I answer your question? Is there have to be a poverty component to the county, or is it just a 50,000?
No, it's just a.
Gotcha. Thank you.
No, sir.
Keep on.
Moving into to actual Medicaid benefits, we shared these slides in the amended budget. No changes there in terms of enrollment. Moving to actual benefits and the dollars associated with it, I wanted to go ahead and just kind of show it across all the different programs. So ABD, fee-for-service, LIM, managed care, Peach Care, CHIP, as opposed to the slide, the line numbers, because it's going to duplicate across multiple programs.
So just clarify. So ABD, low-income Medicaid, and they're the same throughout, and that's correct.
There's
the numbers are different, but the percentages are the same. Or
Well, they're in a different section of the budget, so this is just putting them together.
put them all together. That's what I was
Yes,
trying.
sir.
That's
Just-
what I was trying to say,
if-
but
if-
you said it
yeah.
better. Great.
If
I'm
there-
sorry. Sorry to interrupt.
If there's a 5% rate increase, it's going to be split across all of them. So we're just going to talk about it in the aggregate.
That's great. I confused everybody. So go ahead.
We provided an update on the growth projections, so this is just a reflection of those. With that, we had the adjustment on our FMAP that happens every single year. Our Moving down to Part B and Part D, those are your dual eligibles. We had that annual adjustment. We trued that up, and those are the house changes, is just reflecting those updated numbers as well. Moving to the next slide. House adds. The first is the dental code rate increase. It's approximately a 20% rate increase across dental codes. The next item is DME floor. This is just saying that in managed care, the DME rate that the managed care providers, managed care organizations pay to providers should at a minimum be the fee-for-service fee schedule, so $1.3 million there. The next item is increasing PRTF rates to $800 per day. Currently, it's around $649, which is about 75% of the Medicare 2024 Medicare fee schedule. Next item is autism rates. Our training of parents with autistic children. This is about a 50% increase on ABA code 97156. The next is increasing the PPS prospective payment system rate for FQHCs. The House asked for us to look at the highest PPS for all FQHCs and what it would take to bring all the other FQHCs up to that rate. Next item is a reimbursement for air ambulance. It provides up to 67% of Medicare. Next item is a heart and lung transplant. So currently, Medicaid only covers heart and lung transplants for children. This line item would add coverage to the adult population. Next item is increase for EDWP case management. My understanding this was a House ad and possibly an association request. Next item is registered dietitians. And if I can find my notes on that one. This is ability for dietitians to bill for dietitian codes the same way the physicians bill today. Next item is $6.8 million for increasing or adjusting the fair rental value, bringing the RS means index. This is and the facility age to 40 years and a depreciation of 1.25. This is all for the skilled nursing facilities. The next item is for privately owned intermediate care facilities for intellectuals with developmental disabilities. Again, there's one IDD SNF unit in the state, so it would be increasing a rate for that facility. Next item is nursing home vent rates, which is approximately a 5% rate increase. And going down, I apologize. Did y'all get the updated? Yeah. I think that's everything for Medicaid. I apologize. Moving into SHBP, the final program within our budget, it is a yes item, but I did want to highlight the change. It did go from the governor recommended $2,028 as a per member per month amount for certified and non-certified personnel on the school side. The House adjusted that down to $1,935.
All right, what line is that?
That is 93.3.
Okay.
Just a language change.
Language change, got you. Okay, all right, thank you.
Question on 93.1. I can't keep all the bill numbers straight around here. So House Bill 196, what was that?
NADAC pricing is what that was. It went into effect in January 1 of this year, and that amount is associated with the fiscal note that was provided last legislative session. Y'all are just providing those funds to match the fiscal note.
For the people online, NADAC.
National average drug acquisition cost.
Gotcha. All right.
So
That's,
this is
that's
the-
pretty good on the spot. I'm impressed. Good deal.
For a senior citizen,
Yeah, there you go. He pulled it up. Gotcha. Thank you. Questions from the committee? All right. Thanks so much.
Thank you.
Appreciate that. All right, George, Board of Dentistry. And then in the queue is, which goes along with that, are you doing Board of Pharmacy too, or just dentistry? Just dentistry.
Oh, no, both.
You're doing both? That's what I was thinking. Okay, great.
But I'll hand it.
Okay.
Ms. Arvin?
Yeah, awesome, thank you.
All righty, thank you.
Good morning, Chairman Watson, members of the committee. My name is Clint Joyner. I'm the Executive Director of the Georgia Board of Dentistry and the Board of Pharmacy. With me this morning is Director Stacy Altman, who's the head of our investigations unit for dentistry. I've asked him to be prepared to answer some questions this morning if the committee has any regarding dental investigations, as it seemed there was a bit of an appetite during our last presentation. And then also Dr. Michael Knight, who is the immediate past president of the Board of Dentistry. All right, okay, you're already on it. Jumping right into dentistry, there were 3 changes, and I'll cover them in detail shortly. But a summary is in line 85.5, the House added an additional criminal investigator for a total of 2 under this bill. The governor's proposal had included 1 criminal investigator. And I want to mention for this particular investigator, the equipment and funding for the vehicle was actually included in the bill for AFY 26. So that's why on line 85.7 you only see equipment and funding for 1 vehicle and protective equipment, and that's related to the investigator the House added. And then lastly, at line 85.8, increased funds for a 3% pay increase for the board staff. And that is also mirrored in the Board of Pharmacy. Starting with lines 85.5 and 85.7, an additional investigator is needed because our investigative need currently exceeds our investigative capacity, and we estimate that 1 investigator will. I apologize for this was corrected after I submitted it. It should read 1 investigator will add approximately 40 cases closed per year, not 15 to 20 per month.
We had that in our folder, but it doesn't, but that's okay. You're good. About 40 closed a year.
Yes, and at present, the unit is actively working about 100 cases, which are a blend of compliance, infection control, and more complex cases involving patient care issues. It is anticipated that the unit will close that same number of cases this year, about 100 cases. Adding 2 investigators will bring that caseload to about 140 cases closed per year. As we build out, we expect that we will continue to build that about 40 cases per investigator. As I've testified before, the board is on track to receive over 1,200 new cases this year and received over 1,000 last year. And so our production is not matching what's coming in. However, as we add additional investigators and as discipline becomes more common, and we are able to move through cases as we begin to put teeth back in the tiger, so to speak. We anticipate that we'll see an increase in regulatory compliance and a decrease in complaint volume, which we're hopeful that effect will be cumulative. So ultimately, ultimately, we're hopeful that the only solution to this problem is not going to be simply throwing additional personnel at it. Lastly, for the Board of Dentistry, the House added a 3% pay increase for staff and our subject matter experts. The board currently sits in a situation where we have deep information silos, in that one employee knows almost everything the board knows about how to process retail applications, or how to do dental applications, or particularly in Mr. Altman's case, how to do investigations. And that's because for so long the board has had one person to do each thing. As we have in the last couple of years added additional licensing analysts and investigators, we are beginning the process of cross-training so we can break up those silos, and it won't be, so that while all of our employees are important, there's not going to be a critical single point of failure situation if somebody was to leave. And so as part of that effort, we requested a pay increase.
Okay, thank you.
Staff. And that concludes my presentation on dentistry, or for dentistry.
Do you have anything to add? Do you have anything to?
I'm here to answer any questions y'all may have about, that whole side of it, as far as statistics or anything else.
All right, we got a arriving question. Senator Allred.
Mr. Chairman, thank you all for being with us and presenting. Are there threads or trends or great abuse in one area, or how would you characterize?
So the primary complaint regarding quality of care would be the main one that we have. The next would be fraud. The next would be unlicensed practice within the state. So depending on the type of care that was received will determine if it goes to criminal or compliance agents. If it harmed the patient, it goes one side. If there was just in severe harm, if not, then it goes to the compliance side, who would handle it, and that just determines how many hours are going to be needed to be used to work that case specifically. So, but those are the three main that we have right now.
Thank you.
All right, so when we get the board, you're president of the board?
Immediate past president.
Immediate past president. Why don't you come up and how long have you been there?
2019.
19,
Yes,
so it was 7 years. And you've been there for how long?
Since 2022 as the board's legal counsel, and since 24 as executive director.
I guess last time you were here is that it's just a little disappointing to hear about. That was the first I'd heard there was such a backlog. And how do we get here?
Well, when I came on the board in 2019, that was the same question that I asked. And so I had the honor to serve as president for 2 years. That's when we were fortunate to get Mr. Joyner as the executive director, and Stacy came back as chief investigator. We're trying to get to these backlogs. We have an investigative committee that really works diligently. Sometimes we do multiple cases in a month, and we have meetings outside the normal meeting time on the Fridays that we're here. I will tell you, one of the things we're seeing is there are more non-dentists coming into the state. They're posing as different organizations that they don't have our patients' best interests in mind. It's all about the dollar. And we're seeing that much more than I did in 2019. We had an incident that one came Friday to our board and tried to really blow smoke up our, pretending that teledentistry was legal when currently it was not, especially with ortho. So we're seeing more and more of this, and it affects the quality of care. It's also a lot of non-care. We've got organizations out there that are just doing a lot of unnecessary treatment for our patients in Georgia. And as y'all know, in the end, that's added insurance costs, premiums for all of us, as well as Medicare costs. So we need more investigators to really try to really put our thumb on some of these and really get them out of state. We're even seeing more deaths involved with some of these companies. There's been an uptick in that as well, and we have a grave concern of that, about that.
So there's no lack of legislation or laws governing this. It's really a lack of enforcement, and is it easier to set
No,
up
so
shop?
we're probably going to have to add some laws in regard specifically to these organizations. They skirt the law, let's put it that way, as it currently is written. So we would like to try to, we need more investigators to do what we currently
And
need to have
we've
done.
added more, and I think
And I
got
appreciate all
attention.
y'all
So
done.
yeah, I mean, a month ago or 6 weeks ago was the first I'd heard of this. So, and I've been chair for a while. So anyway, so if we need legislation, we need to address that. And we've got, I mean, Representative Hawkins is a dentist, or he just retired, so I think he'd be a great person to carry that if we need that. So let's address that. And
Thank you.
let's continue to work with you, and let's get these backlogs cleared up. And if we need legislation to tighten this up, that's fine. So we want to
Can I add one thing?
certainly.
I think some of what's happened and why this seems to have suddenly become a problem is that the board sort of was running for a long time after it left the Secretary of State in 2013, really in just absolute silent mode. There wasn't really a relationship with DCH. There was not great relationship with the governor's office, and certainly there was not much involvement in coming over to speak to the legislature. When I got in and saw that all that was going on, I started to establish those relationships, and we now have great relationships with all three of those entities. And so this is not a problem that all of a sudden sprung up.
No, it doesn't sound like it at all. That's why I was a little bit
yeah.
flabbergasted last time that was first I was hearing about it. So I'm glad to hear you got communication going on with all of those, and let's maybe quit looking back and look forward and see what we can do and work with you.
The board members were as surprised when all this was brought out to them as well.
Okay.
I would like to say the governor's office, the Senate, and the House have been most kind since we've started addressing these issues, and the current administrative staff we have, for what they do an excellent job.
Okay, we'll keep on working with you. Thank you. Appreciate the follow-up.
Thank you.
All of you. All right. We are, who's next on the list? Georgia Board of Pharmacists. I'm sorry. Yeah. Okay. All right.
Unfortunately,
So
you're stuck with me. for
you want
another
to
5
change the
minutes.
part of your hair and you're it. Okay. All right. Okay. All right. Okay.
All of the additions for the Board of Pharmacy were additions by the House. None of these were in the governor's initial proposal. Again, I'll discuss them in detail shortly, but the House provided funding for the hiring of an executive assistant for the executive director, funding for the addition of a new CSR position, and again, for the same reasons discussed before, 3% pay increase for board staff. Sort of as we just were discussing, the executive director's role has evolved in the last couple of years, and a lot of threads intersect at me. And there is no one in our organization to whom I can delegate things like administrative tasks. And
We got it. That's so. We're sold. Okay.
Okay.
All right. Okay.
If I could ask Mr.
Certainly.
Being the general counsel for both boards as well as executive director, essentially, is that accurate?
Yes, that is correct.
All right. Thank you.
The next ad at line 86.5, again, was purely from the House, was to increase funds to hire a customer service representative. The board receives about 86.5 calls per hour and has a high missed call rate. That 86.5 calls per hour is during what we would term a low period. It goes way up, double or triple during renewals, and at those times, those are all hands on deck. If you have a voice and two hands, you're on the phone.
We're sold on that one too, and you got a 3% pay increase. All righty. Anything else?
Did I need to discuss the pay increase?
No, I don't think so. Questions from the committee? We're all good. Thank you.
Thank you so much, Chairman Watson
All
and
right.
committee members.
Appreciate it.
I'm glad I was able to do that without having to be budget by filibuster.
Yeah, no, yeah, absolutely appreciate it. Georgia Board of Healthcare Workforce. How are we doing with time? Not good. We're not doing good with time. Did you hear that, Mr. Basine? All right.
Good morning. Nice to see you.
Okay. All righty. Okay.
Well, in the spirit of brevity, I will attempt to go fast
All
and,
right. What
and
lines are you on?
be descriptive. Good morning. Chet Basine, Georgia Board of Healthcare Workforce. Thank you for having me here. What you will find with our presentation is I have the page numbers to your budget document in the heading of each slide, and then the line numbers are on the left-hand side, so if that helps navigate. In our administrative budget, that's section 94, there were no changes between the governor's recommendations and the House recommendations. So I'll proceed to the next section, which is page 30 in your budget docs and line 95. That is graduate medical education, and there is a few different changes between the two here that I'll go through. Line 95.1, the governor had 105 new slots, and the House increased it to 147 new residency slots, and the difference is between $2,096,412 from the governor's recommendation to the House's recommendation takes it up to $4,793,685. Line 95.2 and 95.3, just for the sake of time, were no changes, so I will speed through that. And then I will land on line.
Help me understand 95.1. So they are not naive programs. And are these using existing ACGME approved slots?
There's a combination of slots. I believe it's at Emory and MCG, in emergency medicine, anesthesia, and radiology between the two different sites. Both of those programs are above cap.
So for everybody who's listening, they're not a naive program, so they're not paid for by Medicare. They do get their bump of 200% of Medicare funding from baseline because they are a teaching program, and they get money from DPP. And so are these forever? Are these startup or what?
These are additional slots, is my understanding, so just for residency capitation.
And we came at 110,000. Where'd we get that number from?
Those are figures, since there was a House ad that these respective institutions and the House had those communications.
The average pay for these residents, their salary is?
In the vicinity, depending on the program, it can be as low as 55 and as high as 70,000 is what we hear in terms of resident pay, purely for salary.
All right. That's not benefits. Okay. So there's a little fudge factor in there, and are they going to add more slots if they can do that? I mean, and they're going to get 200% of Medicare because of their residency program, and I'm just throwing that out. All right, move on.
Okay. All right, well, I'm going to move on to 95, further on the GME budget, 95.4. That was the House recommendation to reduce funds just due to the delay in the state plan amendment.
Hang on just a second. So so they're not redesignated. I'm gonna go back to the residency. They have not
Sure.
redesignated rural, right? Like Piedmont. Piedmont redesignated rural, so they were a naive program. And Wellstar's not done that?
Wellstar, not to my knowledge.
And the reason they have not done that, or we haven't asked them to do that, or do we know why?
I
Why
don't
they
know
haven't
the
done
why
that?
behind
Just
it.
too much on their plate?
I don't know the why behind the Wellstar.
Okay, all right. So maybe that's a question we need to have with Wellstar then. Thank you.
Sure.
Okay.
No, good question. So 95.4, the state plan amendment that was in the funds for in our budget for GME, those funds are being removed from the House and their recommendations. 95.5, that was also in the amended budget. That was for rural general surgery and child and adolescent psychiatry slots. That was just a way to reclass the funds. That was $734,438. And then rounding out in GME line 95.6, you will find 13 residency slots. Fellowship slots for $1,920,000. That is at Emory, Morehouse, Northeast Georgia, between Hem/Onc, pulmonary critical care, GI, and forensic pathology. And last but not least, 95.7, one-time funding for resident education spaces. That is for Northeast Georgia and Archbold for classroom learning and new ACGME requirements. So that is GME. I'm going to move on to healthcare education programs. That's page 31 or line 96. There are no changes for the funds for PCOM, capitation funds for their medical students. Line 96.2, there is a change from the House, $150,000 for Andrew College for their nursing program. And that is it for healthcare education programs. I'll move on to healthcare practitioner loan repayment, or loan repayment is what we call it. There are no changes there, so I will skip to the next section, which is page 32 of your budget, or line 98. This is for the Mercer School of Medicine. You will see 98.1. Both the governor's and the House's recommendations are the same, but 98.2 for a rural pediatric residency training track. There's a $4 million recommendation from the House, and that is in partnership with CHOA.
And that's one-time funding, or is that looks like continuous funding?
My understanding, it is going to go through an annual review, but it'd be a multiple-year endeavor.
So why is it $4 million for that? Can we have some details on that?
I can I can get more if you are requesting it, but right now I know it's between Mercer and CHOA and for peds.
Just some details.
Okay.
They should be able to give us the details on that.
Yeah, I was just going to say that if it's a pilot program, we need to know how many years that goes on and how that's handled.
Okay to proceed?
I mean, does coffee? I just don't know the details of that. I mean, it sounds great, but got you.
Okay.
How'd they come up with that figure? That's all.
Okay.
Do you have anything else?
Last but not least, I've got the section line 99, page 33, Morehouse School of Medicine. There's also one difference between the governor's recs and the House recs. It's $4 million for Phoebe and Morehouse, as Phoebe and Morehouse continue to expand their GME endeavors together, and that is a $4 million House rec.
All right, and so we need a little details on that too. All right, so if
that concludes my presentation.
Okay, thank you so much. Any questions? Just need some follow-up, and not necessarily from you, but maybe from the entities themselves.
Okay, sounds good. Thank you.
Okay. We are at composite board. All righty, and then drugs and narcotics.
slides, sir.
He's got 4 slides?
The rest is for information only.
Alrighty, good deal. So we're running behind time, and where are we on 100? Do we have much changes?
Not much change, sir.
Okay,
But we do have a request.
all right.
So I'll go ahead and- It's not in there. So slide 25 in that handout is where we're going to start.
Okay.
While we're trying to find that, I can just go ahead and start work. Okay. So on
If you
that
could just
slide-
maybe just sort of slide in there, and so you're speaking to the mic so
I see it right
people
there.
online can hear you.
Okay, we got it, sir.
Okay, thank you.
She's got it. Thank you.
And for the committee, we're on page 25, is that
You
right?
shoulda- Yes,
Okay.
page 25.
Gotcha.
Okay, so page 25 will be the House Bill 974. If we look at 100.4, you'll see that the governor's office was wanting to reduce one of the programs by $500,000. The House requests to keep it, recommendation. We also recommend to keep that $500,000 for the Safe Haven program. PHP is fully funded through that as well, so that's $1 million going to those 2 programs that are passed through for GCMB, but we would like to keep those.
Yeah, I think they had the data to support that too, so I think
Yes, sir.
that's absolutely
Yes, sir. Sure do.
imperative. Thank you.
And we paid that money out to them, so it's all going to those programs in full. 100.5, that will be a paralegal position we previously were given the funding for, but it hasn't been allotted to us yet, so we're just hoping to get that funding again through OPB. 100.6, that's the House recommendations for our recommendations for personnel, increased funds for a medical director and a compliance inspector. So that will be their recommendation that will give us additional personnel. If you go to slide 26, you'll see all of the legislation that we have come in at Georgia Composite Medical Board that will cause some physical impact to us that we will need additional personnel for. So we're requesting additional personnel to be able to operate these different legislations when they go through, which we know majority will. Slide 27.
So tell me about the HB 717. That, I don't think we've seen that in the Senate yet.
Yes, sir.
Psychedelic assisted treatment there.
That's the ketamine clinic bill.
Gotcha, okay.
Yes, sir.
I wish they just say ketamine. All
Yes,
right, okay.
We're planning for the psychedelic assisted treatments too, so we named it that.
Anticipating, I
ketamine is the one
100% agree, but you know, when people say ketamine versus psychedelic, that just sort of puts me in a different frame of mind. So
Yes, sir.
I got it. So,
Yes, sir.
but it's not. I agree with you. And so that's basically pain clinics on the steroids,
Yes, sir.
and we're going to regulate that a little bit, and
Yes, sir.
because they're getting a little bit out of hand. So
They're moving into the pain realm, not
Right.
just the PTSD realm. So
gotcha. Okay.
we'll regulate that. That will be a cost to us adding it to our system as well as regulating that, so and licensing that.
Mhm.
And then the internationally trained physician bill, I think that's where the House gave us the medical, or recommends the medical director with that. That's going to be key to that bill. And then we'll have to operate those. So these are the positions that we were needing. Slide 27 will actually show the positions that we are recommending we receive to be able to operate all of this. It's a 5 additional positions on top of the 2 that the House recommended. So we're trying to get licensed tech, criminal investigator, compliance inspector, compliance specialist, and an attorney on top of the other that the House are recommending. So we would appreciate any assistance with that. I also have stats included in this presentation on slides 3 through 7 and 9 and 12. Won't go over them unless you need me to, but that will show you the need for these additional positions to kind of show the uptick in compliance-related matters and complaints that we're receiving. Our licensing, the funding you provided us the last few years to do our licensing has really improved, so we appreciate that. And we can show through licensing how, if we get these positions in the funding, how we can do with compliance and investigations as well.
So for the general public listening, and we've gone, your numbers, you're going from 149.6 day average for licensing a physician down to 49.4.
Yes,
So that's pretty efficient.
Yes, sir.
Probably could do a little bit better, and I'm sure you're looking for that, but
Looking for 2 weeks.
that's still pretty good.
Yes, sir.
Going for 2 weeks.
Yes, sir.
Wow, okay. All righty, that's an admirable goal. Okay, anything else? No?
No, sir, we'll just
Any questions
appreciate
from
any help we can get.
anybody? Okay. Well, thank you. I know with the legislation, those add burden sometimes, so hopefully we can anticipate that time. Yeah, that's true. Or the big budget, which we're on. So we'll see if we can help out. Thank you.
y'all. Appreciate it.
Who's next? Oh, Drugs and Narcotics. Georgia Drugs and Narcotics Agency, and then DHS, and we're tight for time. Thank you.
Good morning, Chairman. Good morning, Committee. Michael Kronbach, Georgia Drugs and Narcotics. Just quickly, we conduct the inspections and investigations on behalf of the Board of Pharmacy. We conduct about 3,700 inspections of all the facilities that the board licenses in the state of Georgia, as well as the investigations, somewhere around 500 investigations per year. Simple organizational structure for your reference. Straight into our request, we're requesting 2 additional people this year. To be clear, we're requesting no additional money for equipment or vehicles or training. All of that we can use existing funds for. We're requesting salaries. The governor's budget and the House recommendations are the same, so I've got them listed here. The 1 through 4, 101.1 through 4 are going to be statewide adjustments, so I'll only talk about 101.5, which is the increase for 1 special agent.
And the governor agreed, and the House agreed, and
yes, sir.
So no changes.
Correct.
Gotcha. All right. I think it's important to note for the general public that, I think that's the statistic that you have in here, that you do inspect pharmacy facilities at least every 18 months, or you're close to that, 70% compliance, and working on.
That's correct, sir.
Okay, working on getting that down. So that's what part of this is about.
Yes, sir.
Thank you so much. Appreciate it.
Thank you, sir.
Okay. DHS. The biggest hole in our budget. All righty, come on up. Who's here? And what lines are we on? Where are we?
Morning, Chairman Watson. My name is Chris Sapchin, the DHS Chief of Staff. I'm joined by Demetrius. Oh yeah, all the neat slides.
Why don't you speak in the mic, tell us what you do while she's loading up.
Sure, DHS Chief of Staff, and I'm joined by our DFAC CFO and our DHS CFO. So there's 19 changes between the governor's recommendation and the House changes, so we're just going to go right through those very quickly. So on line 187.4, the House has recommended $125,000 to increase funds to expand services for at-risk girls. On line 188.6, the House has recommended an increase of funds to support the attainment of child support for out-of-state non-custodial parents, totaling $440,000.
What line was that?
188.6.
188.6?
Yes, sir.
Okay.
On
Okay.
188.7, the House recommended an increase in the hourly rates for SAGs as previously briefed by other departments.
That was what we previously discussed with the previous agency, and that goes throughout the budget.
Yes,
Thank you. Okay.
On line 189.5, again, increasing the hourly rates for SAGs, but just a different program, that's for child welfare. On line 189.6, there is a $180,000 increase to be coupled with an additional $820,000 from the Children's Trust Fund to enhance statewide capacity for CASAs.
CASA program,
Yes,
thank
sir.
you. Uh-huh.
Line 189.7, the House recommends $3 million to support reunification, youth for exiting foster care, and families at risk of child welfare involvement.
Can you give me some details on that?
We're still receiving some details from the House and getting, we are still awaiting some further details from the House on exactly what is intended by that ad.
Okay. So when you get that, can you just give us some follow-up? That'd be great. Thank you.
On line 189.8, there's a $1 million reduction to transfer funds from HS to CJCC.
So it's transfer, and we'll see that later in the budget,
Yes,
right?
sir.
Great.
Line 182.4, under elder abuse, there's an increase for $8,000 again for SAGs. On line 193.3, the House recommended an additional $3.3 million to increase funds for Georgia Memory Net for substance treatment expansion.
What line was that now?
That is line 193.3. 193.3. On 193.4, the House has recommended $1.3 million to provide funds for non-Medicaid home and community-based services. And in 193.5, an additional $2 million to increase funds for caregiver support services.
Hang on just a second.
Yes,
Let's
sir.
catch up here. Can you give us some details on the Georgia Memory Net?
Yes, this is a ask. It's for an increase in, well, they want to do the infrastructure for delivering the Alzheimer's treatment drugs. They plan to stand up a primary care pilot for workflow streamlining. They also want to engage in behavioral health and mental health training, as well as they plan to increase the subcontract money to the max, who are increasing the diagnostic and drug delivery capacity within the existing max that we have.
So, and the most expensive thing in that is the drugs for Alzheimer's you're talking about,
Yes.
and the follow-up. Gotcha.
All right, so on line 193.4, the House recommends $1.3 million to provide funds for non-Medicaid home and community-based services. And at line 193.5, $2 million to increase funds for caregiver support services. On line 195.6, the government recommended $12 million to increase funds for a SNAP payment accuracy program effort. And on the same line, the House has changed their recommendation to $11 million approximately to increase funds for eligibility staff to reduce the SNAP payment error rate. One thing to note while we're on the topic of benefit programs, CMS in the fall changed a long-standing interpretation of regulation about how they pay for certain eligibility staff and the match rate they get from the federal government. It has been reduced from 75-25 to 50-50. Because this happened after we talked and did budget development, that is not in, of course, the official request, but we've discussed with OBB, HPRO, and Senate budget. We expect the annual impact to be approximately $11.2 million going forward.
It is. I mean, that's just unavoidable.
Yes, sir.
They changed the formula on us, and we got it. Understand. Still 50-50, 75-25. Gotcha. Thank you.
Yes, sir. Moving on to out-of-home care, looking at line 196.2, the House recommended $300,000 for providers of clothing and supplies for youth in foster care. This is distinct from the initial annual clothing allowance paid for all foster children. And on line 196.3, which includes $250,000 to place foster youth closer to their biological families. Next, on line 196.997, there is a transfer from Safe Harbor to out-of-home care, as you're familiar with. Moving on to line 196.998 for out-of-home care, the government recommended $21.2 million, and the House increased that to $48.3 million to help address the deficit in out-of-home care. Line 197.1, the House recommended $100,000 to increase funds for community youth wellness. And then in 197.2, the House recommended $1 million to partially fund the administration of a summer nutrition program, also known as Summer EBT. And finally, on line 500.1, the House recommended $3 million to create an integrated child welfare reporting system. That's a bold move by the House to directly address one of the main causes of the out-of-home care deficit, which is replacing our aging child welfare information system, SHINES.
Anything else?
No, sir.
196.998, update on the deficits out of home care.
We do not have an updated deficit number for you today, sir.
Okay. $189.8.
Yep, still the same deficit, 85.7.
Just a little update on that, 189.8. That's the reduction of CJCC, Criminal Justice Coordinating Council.
So we have traditionally had a contract with the Children's Advocacy Centers of Georgia for them to administer a contract for their children's advocacy centers across the state. Recently, because our partners at the Criminal Justice Coordinating Council, CJCC, I guess also do similar work with them through their budget, we tried to kind of consolidate. So we have been subcontracting with CJCC, who now owns that contract directly with the children's advocacy centers. And so this is just aligning the budget with who owns the contract now.
And the House reduced it by?
It's going to be reduced by approximately $821,496, which is the amount of the State Children's Trust Fund that will not be transferring with that contract.
Okay.
So it's going to be $1 million in state funds, and if I remember correctly, approximately 1.6 in TANF funds also are fund that contract.
Okay, thank you.
Yeah, thank you. I just wanted to make the point for the people that are watching. The big hole in the budget, we're doing our best to help with that, but that can't happen every year. So we have a study committee that is a joint study committee between the House and the Senate to investigate the increasing costs of out-of-home care and try to figure out what we can do to better handle that.
Yes, ma'am.
Any other questions? No, thank you.
Thanks,
Appreciate it. DPH, and then veterans. And it looks like we're going to be out of town and out of time for any further.
We'll get you back on time, really. Promise.
It's over at 10:30, so I don't know.
Okay.
All right.
Very fast. Okay. I won't even talk about the statewide changes. You know those already.
Yes.
Moving on to the House changes. There are a number of pass-throughs. 3 pass-throughs to Grady. That's the stabilize services and maintain essential infusion and emergency care. Another one to for the Georgia Poison Center, and the Trauma Recovery Center, which is really behavioral health rather than trauma. And then there's some 247.7 for Sickle Cell Foundation. The cardiac care grants the hospitals, which will be in our agency, and the Coverdale Stroke Registry. I'll be happy to talk about more.
Can you give us some more detail on the Coverdale Stroke Registry?
This was a program that we had. We lost some federal funding. We've been able to maintain the registry with the current epidemiologic funds. What we haven't been able to do is to do the kind of hospital-based reports that hospitals would like to have about their outcomes and efficiencies. This will And we can talk more. I think the intent of this was to put staff back into epidemiologic.
Is that still needed?
I don't question the House's judgment on this. I think we could probably accomplish this with less money, but I shouldn't say that.
Okay, you didn't say it. All right,
Okay.
strike that from the record. Okay.
What's that?
You know, that's, someone may have had a stroke by hearing you say that, so. All righty, thank you.
No, I think that's a lot of epidemiologists.
I thank you. We
But
appreciate
I
it.
think that the registry has not been has been robust, but we have not been able to do the hospital-based reports. That is true. The public health laboratory, this is a very easy, I think, request because it's budget neutral. It's just consolidating 6 budget lines that we had to juggle to understand exactly how we can make the lab more efficient into a single budget line. It was extraordinarily hard to do, and but with great help from OPV and others, we've been able to create a single budget line, which I hope you'll approve at no cost to the state. And last but not least, many thanks to the House for further expanding our home visiting program. This is, I think, the single most significant program I have worked with in my entire public health career, which has included PEPFAR, by the way. And then to see this program developed in Georgia, based on Georgia data, able to address the needs in every county that it's been in, based on those needs and resources in that county, has been extraordinary in such a short time to see the outcomes we have been able to achieve. What's interesting, the expansion took place is being, the governor expanded to 75 counties. In his budget, the House has added 62 additional counties designated by the federal definition of rural, as Dr. Burke was talking about, which I think unexpectedly eliminated Northwest Georgia from the expansion. But we are just very, very grateful to be able to look at this expansion. Remember, this is staffed by nurses and community health workers, so there are many, many different home visiting programs. This is the most cost efficient because of our use of community health workers, and broadly based because we also offer medical service as well as those linkages to behavioral health, social services, other things, and as well as the care coordination and assistance with other activities for the family. So I can't say enough good. I know you're.
I got it.
You
It's,
heard it.
it's
You
doing
heard this
great.
before.
I've heard a lot of anecdotal things, and I'd love to see some data on
We
that.
have data, and Emory is actually helping us with
Okay, so I really would like.
and that completes my
That'd be great. So-
enthusiastic support for home visiting and everything
So
else
just
in our budget.
just give me I would love to see some data on that, and tell me about the on the chart you can see the Northwest Georgia. So they did their population base, they're greater than 50,000, and
That's exactly right. Based on
Right.
population, they were excluded.
and those don't seem like well. Let me
If you look at outcomes, there are some poor outcomes up there, particularly according to our data based on mental health issues for the moms and pregnancy outcomes because of that. But I think it was just based on the use of the federal definition of rural,
Okay.
which
All right.
didn't look at as the earlier counties chosen were based on need and outcomes of pregnancy.
Could I get a clarification on that, Mr. Chair?
Sure.
Could you just highlight the change and what it was and what it is?
The expansions initially were done based on pregnancy outcomes, both for mother and babies, as well as access to care and other challenges to receive care, and not just rurality. And I think the House decided to choose that definition of rural, which is used for HRSA, for community health centers and other things. And in doing so, I
That
think
definition being?
less than 50,000 population, and in doing so, I don't think they mapped it out. I was surprised when I saw it too, because you see 62 additional counties. You don't think that Northwest Georgia will be excluded.
All right. Thank you very much.
Okay, with enthusiasm, I step down.
And Georgia Department of Veteran Services.
Okay. Good morning. I'll go through these quickly.
All right, so I'm gonna,
Yes, sir.
we're supposed to be out here in a minute, and I skipped vocational rehab agency, so if they can just give us the information after the meeting, and you got, the floor is yours.
Okay, we start on page 77 of your trackers. We're section 48, starting at line 368, no change in admin. Those are statewide adjustments. Going to our cemeteries, the House did add $102,000 for the Augusta Cemetery Director. We did not find out we were going to be able to get a cemetery, a veteran cemetery in Augusta until December, so that was outside of the budget process. We are still short $200,000 for debris removal. We did get property from DBHDD that was transferred to us, but that is significant debris. It's concrete, it's rebar from Hurricane Helene that is right at the entrance of where we're going to have a cemetery, so that's what it's required to remove that. So that's a new request for us. I shared that just after 369.6. Moving on to nursing homes, again, very quickly, we are in the middle of a procurement process to operate our skilled nursing home in Milledgeville as of the 1 July. And just based on updated cost projections, we anticipate a shortfall of about $5 million. So we wanted to make the committee aware of that as soon as we knew. If that's not addressed, then of course we will have to reduce operations. Going to page 79 and 80 on our benefits, the first house adjustment was an increase where a pass-through for a TBI program, specifically that's the SHARE initiative at the Shepherd Center, and 48.4.8 is actually our additional funds to partially sustain in the big budget our technology platform that provides closed-loop referrals along social determinants of health and allows us to expand how we help veterans and their families without increasing personnel. And then the big thing to talk about, I know Senator Kirkpatrick led a 2022 Senate committee on the need for new veterans homes that identified immediate needs in North and South Georgia. You can see based on where we have our residents coming from for Milledgeville and our Augusta home, there are still significant needs in that area. We've been working with Albany and their community to find property and have found property for that. Just so you know that it's a 35% match with the federal government, so it's $38.5 million is the state match versus $71.5 from the federal government for a new veterans home, our very first and only new veterans home. We have existing institutional homes that were given to us. And so you can see within less than 5 years, if you were to fund 120 patients within our existing facilities, if we had that capacity, which we don't, you would actually be able to fund that state match for a new veterans home. And just looking at this is what our homes look like. The challenge is we have double rooms, so infection control is still an issue. We have congregate baths, so that's a safety concern for our patients with mobility issues. They have to go to the end of the hall. And so if you look at what every other state has, this is actually designed by the architect we're working with. They have, private ADA compliant rooms. This is in every other state other than ours. And so what we're looking for is ideally that capital investment that you can't get by just renovating our existing facilities to
I
be
got
able
you. I
to serve our
appreciate that.
veterans.
We're over time, and
I'm done. Yes, sir.
Thank you. Any questions from the committee? All right. Thank you so much. We appreciate everybody being here, and we will happy to stay around, discuss further, but the meeting is adjourned. Thank you.